Assalamu alaikum dear doctors. In this video I am discussing a murmur. So first we will hear the murmur, then I will discuss the disease. What we observe in this video, we are seeing that a 6-month infant and someone auscultating the murmur, that is an aortic stenosis murmur we are hearing. Discussing aortic stenosis. Special features. Aortic stenosis is associated with Williams syndrome, Turner syndrome and rheumatic fever. So remember, this Williams syndrome patient or Turner syndrome patient, they bring in the exam, and that is aortic stenosis murmur we can find. Also, we already heard the murmur. So the pulse is 3D pulse we find. Neck, there is neck thrill plus minus suprasternal thrill present in aortic stenosis. Generally, there is no clubbing and no cyanosis. In inspection, usually no scar, maybe median sternotomy scar we find in aortic stenosis. Now the apex. Apex aortic stenosis, that is forcible or tapping. Apex is shifted down and out. There is palpable thrill on second right intercostal space and suprasternal notch and carotid. Murmur is that ejection systolic murmur on second right intercostal space radiated to the neck. Increase on leaning forward and on left lateral position and on expiration. Click on left lower sternal edge or apex. If Williams syndrome, there is no click. Maybe with aortic regurgitation murmur. Now investigation, we do the ECG. Mild we find normal, severe we find left ventricular hypertrophy, tall are in V5 and V6, inverted T wave in 1 AVL and V5 V6. Now very severe signs of ischemia ST, depression, inverted T wave and QIN in exam. So it is question in exam that any very severe what we find in ECG, that is ST depression and inverted T wave. Now chest X-ray, we find prominent left ventricular and post-stenotic dilatation. Echo, we find assist the pressure gradient across the stenosis. Types is that number 1 valvular with of aorta and Turner. Number 2 supravalvular, we find Williams syndrome. Number 3 subvalvular, narrowing of the left ventricular outflow. Number 4 subaortic, not severe, no click. Treatment of aortic stenosis is according to pressure gradient and clinical picture. Number 1, if gradient more than 60 mm of mercury, so balloon dilatation by catheter valvopathy. And number 2, open heart valve replacement. Indication of surgery in aortic stenosis. Number 1, failed balloon. Number 2, the lesion is either supra or subvalvular. Number 3, stiff cusps. Number 4, subaortic stenosis. Complication for surgery is that failed infection, arrhythmia, overcorrection, aortic regurgitation. There is heart failure and hypertension. Complications of aortic stenosis is syncope, indication of severity, exercise intolerance, palpitation, dizziness, chest pain, arrhythmia, sudden infant death. Advice we give: limitation of the level of exercise if pressure gradient more than 60. Severity of aortic stenosis: number 1, age of presentation. Number 2, symptoms. Number 3, general condition. Number 4, exercise tolerance. And number 5, echo finding. Association with aortic stenosis: these are Turner syndrome, Williams syndrome, coarctation of aorta, that is valvular aortic stenosis with bicuspid aortic valve. Number 4, other cardiac abnormalities are hypoplastic left heart mitral valve abnormalities and hypertrophic obstructive cardiomyopathy. So this is all about aortic stenosis murmur and discussion. Please do subscribe and share MRCPCH with Dr. Amma Choudhury. Thank you.